Welcome back to the Infertility Files, a deep dive with Dr. Duru Shah. I am your host, Dr. Saloni Gandhi, Associate Doctor and Fertility Specialist at Gynac World. Every day at the clinic, we see millions of women coming with struggling careers but the persistent biological ticking clock. For a long time, this clock has been an immovable force, something that we had to race against. However, with technology, today it is easy to hit the pause button. So today we have Dr. Duru Shah with us, who has seen this evolution firsthand. She has seen the shift from medical freezing to social freezing. Welcome, ma'am.
Thank you.
You have come from an era, you've seen the evolution happening between the time when we couldn't actually hit a pause button to our fertility, where there were no technologies available, to now, or when the egg freezing was only for as a last resort, to now when it is a proactive choice by many modern women. Ma'am, how has this change been?
I think it's a very welcome change, as a matter of fact, because it gives a chance to women to carry on with their careers, to carry on with their lives and feel good about themselves. Otherwise it was that okay, it's time to get married because it's time to have children, it's the right time. And if you see in the villages, etc., when girls used to get married very young, it was, I remember the time when we were in training, when these women came to the general hospital, by 25 they had completed childbearing. They had finished with at least 3 children or 4 children, and we were tying their tubes for them because they begged of us, we do not want any more children, please tie my tubes. The reason is there was hardly any contraception. There was no control over the male partner, and therefore it became a nuisance value for those women. And today when women are educated in the urban sector mainly, of course it's happening even in the rural sector, where they are wanting careers, they want a life for themselves in terms of having something which they can be proud of. They want to delay their pregnancies, and at the same time they are keen to have children with their own eggs rather than using donor eggs. And therefore they have an option today to either have a child earlier and carry on with the children and with their career, which becomes little difficult for many women. So this is a good way out for them. They freeze their eggs and then keep them for years together and then have their children at 38, 39, even up to 40. The government allows you, a law allows you till the age of 50 to have your child if you want to use your eggs, but yes, we do not recommend that. So it's a good technology which is working very well, and this is what we call social freezing, where they are freezing it because they want to delay their pregnancies, and that is what it's been most helpful for. And this is something which even sometimes you have had single women doing this, who want to please. There was one woman who came from Calcutta, I remember, and she was single, and her mother was not going to live long, and she wanted to see her grandchild, so she was forcing her to get married. So she came to me and she says, I am going to have a child with an egg donor and a surrogate, because she was already 40 plus, and a surrogate, and I am going to say I have adopted this child, okay, to please her mother. So she was willing to do all that just for the sake of her mother. But there are many women today who are wanting to have their own biological children and carry on. I think the technology is superb, but at this point in time it's not really very much affordable to everybody. That's the biggest constraint, and the reason being that most of the material we use for IVF today is all imported. The media, the culture dishes, the equipment, I mean lot of it is disposable, used once and thrown away. So in short, we spend a lot on the back end of actually in the lab. The question is, it's expensive because of the injections, because of the material used. Luckily for us, Indian drugs are being produced and they are pretty good. We are waiting for the day when India provides us all the sick material handmade in India, what we call made in India, and that's what is going to bring down the cost of IVF.
Currently there's a lot of work going on making IVF accessible to even the poorer population, because I think government is trying to promote IVF centers in the government facilities as well currently, right?
Yes.
So I hope that very soon it will be affordable to all.
Yes.
And that's the whole.
I'll give you a little background on this. When I was the president of the Indian Society of Assisted Reproduction, I approached the government and brought to their notice what's going on with the rural population and how many of them are being led the wrong path. And I said it's a need of the country where both urban and rural women need this technology affordable. That is the time when Ayushman Bharat was being made. So this clause was added into it, and it was encouraged that all insurance companies should take up the insurance for infertility management. This happened in 2018 or so.
Yes, ma'am. That's really empowering for all our women who are especially very career oriented today. And ma'am, I wanted to just find out or understand how does this process work, because a lot of people are very scared of it actually. They are scared because they've been told it's a lot of injections, it is daily visits. So, and the process itself is it's like a major OT for them, like a major operation. So how is it, can you enlighten us the process of how egg freezing goes about?
Yeah, I think I could just compare it. You know, it's definitely a more difficult process for women to freeze their eggs than men have to freeze their sperms. I mean, for men, it's just there are many young college students who come to donate their sperm because they make money out of it, but no longer. It's not allowed. But the question is that it's very easy for men to collect the sperm, whilst with women, we have to get their eggs out of their bodies, out of their ovaries, out of the system, because the egg is released within the body and it is picked up by the fallopian tubes into the uterus. So, in short, to get that one egg which is released every month, just one egg, even though there are many eggs in the ovaries, we are able to collect only one egg if we go without injections, because that is a natural process where one egg is released. But at the same time, when that one egg is released, there are 25 more eggs around it, which also start producing estrogen and start growing and help this one queen egg, as we call it, grow bigger and mature and then get released and get fertilized by the sperm. So, in every menstrual cycle, you are losing actually 25 eggs, because those 25 eggs die a natural death after supporting that one lady. Now, the question is that when that one egg comes out, we cannot sit and collect one egg, because it is too traumatic a procedure for a woman to come every month to collect one egg. And therefore, we give injections to help even those other 20 eggs to grow along with this one egg, so that we can retrieve all 20 of them and we can save them. So, that is the principle behind giving those injections, which are very supportive and help those eggs to grow. So, that is the concept of injections. The second thing is that they take the injections about 10 to 12 days, and those injections now are pretty good in terms of they can self inject, they do not even need to come to the clinic, they just take it just like an insulin injection and can manage it on their own. The only thing they need to come to the clinic for is to monitor whether the injection dose which we are giving them is sufficient for them, is it helping the eggs to grow, or do we need to reduce the dose, or we need to increase the dose. So, they need to come to the to the clinic to get an ultrasound evaluation done, which helps us to know what is going on inside. Accordingly, we guide the patient. So, on an average in those 10 to 12 days, a woman may come 2 to 3 times before she is ready for the eggs to be mature. We have to wait for the eggs to get mature before collecting them, otherwise they get stuck to the wall of the follicle and do not come out. So, therefore, we have to wait till they grow to a particular size, and then we give them an injection called the trigger, which helps the egg to get released or loosened from the wall of that follicle and help us to aspirate it. We aspirate it in a very small procedure which takes about 15-20 minutes in the operating room, where the lady is given some short anesthesia or a good sedation, and the eggs are retrieved vaginally. There is no scar on the abdomen, there is nothing, and that is it. Once she is out of the anesthesia, she is in an hour or two, she is wide awake, she has her cup of tea, coffee, she eats has a nice soup, she walks around, makes sure she is not feeling giddy, and that is it, and then she goes home. Next day she can go back to work if she likes. So, it is not a difficult procedure now as it was in the past, and therefore, I think one should not be afraid of going for egg freezing, because it is a much simpler procedure now as compared to before. The technology of freezing also is much better, we call it vitrification, and it's just amazing, and those eggs get frozen at about minus 190 degrees or so, and can stay forever.
All these ladies are really struggling between careers. Every woman today wants to be standing on her feet, wants to have a good education, and at the same time doesn't want to lose out on the dream of motherhood. So, the technology of egg freezing has really helped them see and have everything at one time.
Absolutely.
That's great, ma'am. Ma'am, now if that period of 15-20 minutes of nap or anesthesia you are saying, so after that they don't need any rest as such for 3 days, 4 days, like how usually after any OT there is?
It's not really rest they need, but they need, sort of to be a little not hyperactive. Like if they are sports women, and if they are running, and if they are jogging or playing tennis or badminton, we recommend to them to take it easy, because the ovaries are still large, and when they are large we do not want them to get twisted, and when they get twisted they could have a problem. So, we tell them that they can go back to work, but not be active enough to jog for at least a week or so till the ovaries take to settle down. Of course, we give them medications to help them, but still I think to be cautious is always better.
Ma'am, how do we know that whether egg freezing is for me or not? What is the right time to actually do the egg freezing? Should I at 40 decide that okay, I am not finding anybody, so now I go for egg freezing?
Yeah, I think that's the biggest challenge for most of the women. They wait that they'll probably meet some, the right person and get married and have a quick baby, but sometimes it doesn't happen. And therefore, we find quite a few women coming at 38, 39 and saying that now we want to freeze our eggs because we haven't found the right person. And there are some women who actually get married to whoever is available right away so that they could have a baby. But that is a big mistake. One has to be sure whom you want to have a baby with, rather than just getting married to anyone available. So, question is that at 40 is not the right age, as we have discussed in our previous episode, that aging is a factor, and for us women in India, we unfortunately we reach menopause earlier than the European women. So, 10 years before that the eggs have also started deteriorating, the quality, not even the numbers. So, we believe that by 32 or so, at least this is what I tell my patients, that by 32 if you haven't found the right person, you are not dating anybody, even if you start dating now, it will take you at least a year to decide whom you want to get married to, then you will wait another year, I mean you will not be immediately having a family, then you will wait for another year trying to see whether you are getting pregnant on your own, by then you will be I don't know what age. So, it is better by 32, if nothing has happened, freeze your eggs.
Ma'am, other than social freezing also, we have medical freezing. So, can you help us understand which patients need freezing for a medical indication?
See, medically it is like this, that if a woman has got some fibroids in her uterus, and we know that she will require surgery because they are large fibroids, but she has got no complaints, or she may be having heavy periods, one of the two. Now, if she gets pregnant with those big fibroids, they are going to grow larger in pregnancy and be very uncomfortable for her. So, we would like to get rid of those fibroids before she gets pregnant. Now, if I go to remove those fibroids, I am going to do surgery and I will try my best to conserve the ovarian tissue, the uterine tissue, etc. But invariably, because when we operate, we are trying to reduce the blood supply, trying to reduce the bleeding during surgery. So, to some extent the blood supply to the uterus definitely gets reduced, and these women have problems with their eggs later on, because when we are operating on the uterus, one of the blood vessel which is supplying blood to the uterus also supplies blood to the ovary. So, when that gets affected, it cuts off some of the supply to the ovary, and there is enough scientific evidence to show that if you are operating on the uterus or on the ovaries, you are going to reduce the blood supply to some extent, and therefore, these women's ovaries may age faster as compared to women who have not gone through surgery. That usually happens in a woman who is a little older, say she is 34, 35, 36. In a young woman, it may not be so. And therefore, the word of caution for young women or for anyone who is undergoing a surgery on an ovary or a uterus is that do the surgery, number one, only if indicated. Of course, it is a malignancy, there is no choice. But every little small tumor you find, every fibroid you find, do not get frightened. Get it evaluated, make sure that it's really bothering you, only then go through the surgery, otherwise wait it out, monitor it, make sure it's not creating any further trouble, because even if you remove one fibroid today, after another 2 years you will have 3 more fibroids. Are you going to get surgery done for no reason? So, if there is a reason, I agree you have to operate, but otherwise, and one could use other methods to reduce the bleeding and then try the pregnancy first. But if they are large fibroids, they come in the way. Similarly, there are conditions like endometriosis, there is polycystic ovaries, there is patients who are going through cancer treatment. All these patients do require freezing of eggs medically before they undergo surgery. But most of the times I find that when the word cancer is used, everyone is such a hurry to get the treatment done that they do not even think, they do not even want to go there, and therefore, many women lose that opportunity to freeze. So, unfortunately, that is so. Those are things which are not under your control, but things which are under our control, we have to guide women. Please do not smoke, take care of your weight, take care of your health, exercise regularly, sleep enough, all that affects the quality of your eggs. So, I think it is enough, those are modifiable factors which is under your control. One can easily do it. But if you are going to have fibroids and you can't prevent them, once they come and you got to manage them.
Ma'am, also we have a lot of patients coming in who are younger, like 28, 29 also, when we accidentally find out that they have very reduced number of eggs, where we have advised egg freezing. So, how do we know as a patient that okay, if I have these factors, I should visit a doctor, probably I might be having a low number and maybe requiring egg freezing a little earlier?
So, yes, I agree with you. We do have patients like this who have had a few periods and then after a certain age of 20, 22, they have stopped menstruating. So, usually these women come to us because they have stopped menstruating, what we call premature ovarian insufficiency. And those are the women usually, if you find that there would be some genetic reason, wherein either the mother has had premature menopause earlier and these girls are heading for a menopause, or it could be that they have been exposed to some kind of radiation or some sort of treatment indicated issues, or it could be that they have something in their body called autoantibodies, wherein their own body is producing cells to kill the ovary, just like you have for thyroid, just as you have for other situations. So, it may be something like this which is causing the problem. Now, if they have got those problems, then definitely we want to save as many eggs as possible if we have evaluated their ovarian reserve. But many people are not aware of this. So, when a girl comes, I haven't got my periods, I have heard some of the patients have told me, they said, don't worry, you must be stressed. The doctor told them, don't worry, you're stressed, maybe the period will come after some time, it will come back. But this is without evaluation. We had a guy who was on protein supplements and steroids because he wanted to build his muscles. Long time he took those steroids because he wanted to be that macho guy to marry that foreigner girl whom he was dating. So, when we evaluated and they wanted to have a baby, his sperm zero sperm in the semen. I said, what happened? After we went through the whole history, we realized it's this whatever he is drinking and whatever medication he is taking was causing the problem. So, similarly, women may be taking medications which may be causing problem with their hormonal status in the body. So, we have to go through the history, find out what are the causes, genetics, mutations which are occurring due to radiation or chemotherapy, any medication which they are taking, and smoking. All these factors can cause a premature failure, and usually the complaint the woman will come with is, my periods have become scanty, my periods have become irregular, my periods have disappeared. Could be either of these.
So, ma'am, basically women who have early menopause should be more careful and proactive towards their daughters to get them tested early.
Yes.
Is what you are trying to tell us,
yes,
right?
it could be genetic, it is not necessary, but it could be genetic, and therefore, we evaluate the girl and make sure whether it is genetic or not. And therefore, if any girl reaches menopause early in life, what we say under the age of 40, that girl should get investigated, because it is important for her to be put on hormone therapy, because otherwise her aging at that age is not good. I mean, forget fertility. For fertility, she can take egg donor. She can use eggs of another lady, fertilize with her husband's sperm and put it in her uterus. That is possible. But otherwise, if she does not want to do that, or if it is against her principles of using a donor egg, then she needs to be on hormone therapy to maintain her health, because otherwise prematurely she is getting menopausal and aging faster.
If I have 10 eggs frozen, I will be able to produce 10 babies, is that correct?
10 babies with 10 eggs, no way. No, science has shown us that one egg can make a baby, yes. But the question is, if you have got 10 eggs and you are going to get 10 babies, it does not happen, because that egg has to first get fertilized by the sperm. After fertilization, the embryo will grow. Then that embryo has to implant in the uterus. We do not know how the health of the woman is, what the atmosphere inside the uterus is, whether high sugars, high obesity, high insulin, high whatever, that embryo is not going to last there. So, in short, the science worked out is that you need at least 20 eggs to have one live baby. Because I told you that when natural ovulation takes place, there are 20 to 25 eggs make that one egg grow.
Yes.
So, in short, we have to get 20 eggs out to get one live child, and it's always, I have always felt that women are genetically stronger than men. I know I am going offbeat, but I can't resist saying this, that a woman has to produce one egg in a month to get that one baby. A man has to produce millions of sperms to get that one sperm to attract that one woman to have a baby. So, I feel genetically women are stronger. They have 2 X chromosomes. A man has an X and a Y. Half that X is missing. So there is enough. I know, being a woman, I am upsetting quite a few men around here and around around the audience, but this is just the funny side of it.
Okay. So, ma'am, the next question is, if I do egg freezing, I will reach early menopause because I am getting all my eggs out in one cycle only. That is the
no, you don't have only 20 eggs, my dear. There are 20 at a time every month which are growing, 20 to 25. In the next month, another 20, 25 will come. So, in short, there are patients where they have received such heavy doses of injections that they have actually produced 45, 50, 60 eggs, and that can be very dangerous. It is not a good thing to do, and it can cause problems to the patient if she has so many eggs growing in her ovaries, and that is not good science and not good clinical treatment. So, I would say max 15 to 20 eggs, not more. But if you see according to, I mean, if you look at it, what is really safe is about up to 15. After that, it becomes a little toxic for the patients.
So, ma'am, every patient who undergoes egg freezing will have 15 eggs, 10 eggs, 12 eggs, or is it different for different people? How would I know?
It is different when we do an ultrasound on the 4th, 5th day of the period. We measure the volume of the ovaries and the number of eggs we see. We do the AMH, which tells us if it's high, we know there are many more eggs. So, the question is that we anticipate that this lady is going to produce more eggs. So, we adjust the dose of injections which we give, so that we support only some of those eggs to grow and not all. Because if all grow, it is going to be quite difficult for the patient.
So, it depends, like if I have a less number of eggs in general or a lower AMH or a lower AFC, then I might have less number of eggs that are retrieved compared to a woman who has a higher.
That goes without saying, because what you see in the ovary on day 3, 4 or 5 of the cycle is what you will finally get, and you may get less than that, but you won't get more than that.
So, ma'am, another thing is that most of our patients come and ask us, if I am taking so many hormones, I am going to put on weight or I will end up having cancer in the future. So, how does that, is it even correlated? Does that have any?
See, there were some long ago, there were papers, some few papers had come in, which research papers which talked about probably some harm occurring because of these injections. But then over the years, there have been millions and millions and millions of women who have gone through this treatment, and they have found no evidence to show that these women are developing cancer. I mean, even if there is cancer, it could be incidental, which could have occurred in those women anyway. But yes, one thing is there, that we must be sure that there is no cancer lurking in a woman before giving her these injections. So, in short, we like to at least do an evaluation of her ovaries, her breast, make sure that everything is okay, get a pap smear done, make sure there is no surgery she has gone through before for any kind of a tumor. So, if we are careful, then usually there is no problem. But if God forbid she has a cancer lurking within her body and you have not checked and you give these injections, it will just make it worse.
I wanted to understand, if we freeze the eggs for a year, a lot of patients ask this actually, because they feel that it is like freezing in the refrigerator. So, if we freeze these eggs for a year, after a year they get spoiled, or what will happen if I freeze them for a longer time, whether I can use them again, I can't use them again, or it deteriorates year by year. How does that thing
There is no expiry date written on it, right? So, in short, the freezing process is a very different process from just putting it in the freezer. The eggs are rapidly vitrified, as we call it, put into a very cold medium and rapidly vitrified, so that the cells do not get affected. These embryos, I mean these eggs are then kept in some vials, which are kept into a special tank containing liquid nitrogen, and that is how the eggs get frozen and kept. We can keep them for over 10 years, but every clinic has to make sure that the eggs are well maintained over there. Means they have to make sure that whatever is required to keep them frozen is there. There are all kinds of equipments available. There are automated equipments, there are everything automated, all that can happen. It all depends, but the process is simple, wherein you freeze them. Of course, there is some technique involved, anyone can't do it. There is technique involved, and that helps the eggs to remain frozen. It is not necessary that if you keep 10 eggs frozen, when you thaw them, all 10 will survive. It is possible that you may lose 10% of it, which can happen with any freezing and thawing process. Same thing happens to embryos, but the embryos are sturdier than eggs, because they also have now that is one good thing, the male component comes in. So, that gives the strength to that embryo, it survives more than the egg is more fragile.
So, basically you are telling us that eggs can be frozen in the same state at that age for a longest period of time. As of now, research tells up to 10 years, but there have been some studies saying that after 10 years also they have given a live birth.
Yes.
Right? Ma'am, whether egg freezing is a better option or embryo freezing is a better option, also, can we also freeze the sperm?
Of course,
Yes,
sperms
so-
can be frozen also, and as a matter of fact, most of the sperm banks have them frozen because it's easier to freeze sperms. The concerns used to be that suppose somebody is carrying an infectious disease like HIV or hepatitis B, that gets transmitted by the sperm to the woman, and therefore fresh sperm was not used. The person who's donating the sperm, his HIV and testing those infectious diseases are tested. They wait for 3 months, they test again. If it's still negative, only then those sperms are released. Otherwise, they are not released. Though there are better technologies to find out whether a person has active infection or not. Today, there are better techniques, but they are much more expensive. So, this is the process which is followed. Now, egg freezing also, donor eggs which were given earlier as fresh eggs, where you take eggs from a donor and use it for a patient. As of today, it's allowed, but I'm sure a day will come when this too will be first frozen and then released after 3 months after testing that donor again, but it's still not there according to the legal processes at the moment in India.
One of the myths is that this is an unnatural process of egg freezing. So, am I increasing the chances of having an abnormal child by interfering with the nature?
See, you're actually, mimicking nature. It's not that you are interfering with nature. It's mimicking, and it's a fantastic science to get your own biological child. And I feel that there is enough evidence available to show that the abnormality rate hasn't increased after we have started doing IVF large scale. So, in short, there definitely is no evidence that it increases the risk, but even natural conceptions, you will find that on an average there are about 9% abnormal children born, 9 out of 100 which are abnormal, but out of them only 2% are the ones with major abnormalities, and 7% are with minor like an extra finger or a little something not right, something twisted. But otherwise those 2% nowadays with good ultrasound means we are able to detect them much earlier, and those pregnancies which are not going to be viable, or those children who will have a very, very poor quality of life, there is an opportunity for the parents to decide whether to bring that child into this world or not, and that can be done. And keeping that background in mind, with IVF we are not seeing any larger number of abnormalities happening. They are actually mimicking what is natural. So, we should not feel that it is because of IVF that the problem is increasing.
So, evidence is largely showing that the rates of abnormal or congenital anomalies is same as that of spontaneous conception. Absolutely. Is what you are trying to say.
Absolutely.
Ma'am, I think the conversation today on egg freezing and how we can actually hit the pause button to the biological ticking clock is very, very empowering for our audience today, because I understand that for me myself, I'm a young girl who has a lot of dreams and aspirations in the terms of career, but always has that thought in the back of my head that okay, maybe I'm aging and I probably need to look at the fertility part as well. But just knowing that I have an option as a as a safety net behind me gives me a lot of strength and motivation to keep dreaming bigger.
Absolutely.
So, ma'am, thank you so much for being here today and sharing your years of experience with us and telling our audience today how this shift of era has happened from medical freezing to social freezing. So, if you have any questions about egg freezing, whether it's the right choice for you, whether you need it today or not, you can always approach us at Gynec World. Our Instagram handle is @gynacworldonline, and you can also email at gynacworldfertility@gmail.com. So today we've spoken about egg freezing and POI, that is premature ovarian insufficiency, where there are less number of eggs. So in the next episode, we will be talking about women who have multiple eggs. They may ovulate, they may not ovulate every month, and that is what we need to discuss, right? So the next topic is going to be PCOS. So we will see you very soon.
A good tip for today: avoid tobacco in any form. No smoking, no vaping, no hookah, no e-cigarettes. Please remember, no tobacco.